And then it looks like the hemoglobin is pretty stable over the last few days as well. The seizure prophylaxis is just from the TBI, and they treat that with the medication Keppra. I know there was some concern in regards to that medication and his creatinine, but it's renally dosed to really cause no overall changes on the renal function. And we have our hospital medicine team taking a look at his medical comorbidities and everything, and it looks like his creatinine clearance, which is the overall picture for renal function, looks to be within his baseline, so they're not worried about that at this time. It's probably a combination of the contrasted studies that he got and some of the blood loss through the scalp laceration that led to that kind of incline a little bit. But we're trying to get him set up, and it actually looks like he has an appointment already with his primary care physician on the 16th for repeat blood draws and evaluation of that as an outpatient from that standpoint.
Okay.
But the wound care on the back of his head is pretty minimal. To be honest, it's closed with absorbable sutures, and it's open to air right now. I do have the plastic surgery residents coming by and taking a look at it just to see if they have any additional wound care recommendations, but it should be pretty minimal, to be honest.
Okay. So you just went through a whole lot of information, and the first 80% of what you said, the family has questions about and possible challenge, because I'm trying to understand. You're saying that his numbers, his H&H and his creatinine, that they're all stable and fine, because last night they were going to do a transfusion. So we're wondering when that changed. He was at 7 and the other number was 22, and those are generally considered for the transfusion. Additionally, the creatinine dropping, not increasing to where it was when he came in, that's down, I think, 4 points. And he is stage 4 kidney failure. And then he had contrast, and then he had Keppra, and he had other things added to his regimen that are challenge to the kidneys. So we're trying to figure out how he's being deemed as stable when we just talked to the nurse last night about the possibility he was being considered for a transfusion. They just wanted to hold off and give his body a chance. But no blood has been run this morning to see if his body responded or if that situation has changed to the decline. We don't know if his blood's up or down from 9 o'clock last night when they were talking about a transfusion. So how did we get to this moment where he's stable and he can just go home?
Yeah, so I don't know how the nurse got a possible transfusion out of his numbers last night.
The overnight care doctor was consulted. Last night's care provider was consulted, and when the numbers came in, Nurse Ethan, the night nurse, spoke to the care provider, and the care provider said, we are borderline right now, and we're going to hold off. We will check it again in the morning. And now none of that has happened. So that's why the family's like, we heard something last night at midnight.
Yeah, I can recheck it right now. So they do all the 24-hour labs in the evening. So typically they're supposed to be, ideally, they're supposed to be drawn at 6 o'clock, but the IV team goes around and draws them the night prior. So those are our 24-hour labs that we get every day. But I can repeat it today just to make sure that it hasn't dropped any further.
Thank you.
But the overall picture is that it's been stable. I mean, a point decline is technically considered stable in our minds, and everything kind of equilibrates after an amount of blood loss. There's no other signs of indication that he's actively bleeding or losing anything because his blood pressure has remained stable, his heart rate has remained stable. He's been a little bit softer with his blood pressures throughout, but that's remained pretty stable throughout his hospitalization. And then in regards to the creatinine, going down is actually a good thing. It's not a bad thing. It's when the creatinine goes up that we get concerned.
I guess is this the same number as EGFR? That I thought that was the kidney number. Maybe I have that wrong.
That's the estimated GFR. Yeah, that's correct. That's the estimated glomerular filtration rate for creatinine. Okay. So if that goes down, that's overall kidney function, but I thought you were talking about the creatinine.
Well,
so
I guess it's
different things. I'm
reading the word creatinine next to the EGFR, but I guess it's EGFR. We know that in stage 4 kidney failure, if that number proceeds to go down towards 15, he's dialysis. And he's refusing dialysis, so we're very concerned.
Correct. Yeah, so that number going down is indeed something to watch out. But for the creatinine itself, in
Okay.
and of itself, actually going down is a good thing.
Okay.
But he's within his base. He's within his base rank for that GFR. We kind of expand that to look beyond this hospitalization. Baseline has been anywhere between 21 and 28. It looks like, and he's at 23. And once again, we consulted our hospital medicine internist here at the hospital, and he took a look at everything, and he's quote unquote not concerned about that, but we should definitely reevaluate it in a few days.
Okay, how do we do that? Is there going to be an at-home blood draw requested or any orders given for like his insurance company to send somebody to check him? Is he going to have an in-home nurse at any time? Any of those
So
orders?
I talked to our care coordinator as well as our social worker, and he doesn't qualify for anybody at home to come into the home and draw his blood because he is ambulatory and not bedbound. So that's why he has an appointment on. I don't know if this was before the hospitalization or if we set this up.
It
But
was.
it looks like he has an appointment. He has an appointment on Friday with the primary care provider.
Yes, that's
so we
correct.
can put an order in. We can put an order in for a repeat blood draw, and he can follow with the primary care on Friday to further address the blood work and creatinine and all that.
Okay. I'll report back to the family that at this time Strong does not find these numbers that have gone down. You know, when he came in, he's over 8. Now it's 7. I guess he was even like 9.6 just 10 days ago, or maybe it's been 2 weeks since the last blood draw record. So for him to drop from the 9s down to 7 is okay. He can go home like that. I'm going to have to give that message to everybody and try to explain all that you've just explained to me, that it's okay and he can go home like that. We thought it was going to be another blood transfusion or more observation, and it's just not.
So do you want him to stay until tomorrow?
We're not
Or the day
saying
after?
it's really, we're not calling with request as much as we are trying to understand what the hospital directives
Right.
are. What does he need when he gets home? Because there is no family really. I mean, we have a couple of grandkids that go and check him, but there isn't anybody in the house with him making a meal or, and he does have a private care aide that he hired, but that's like 2 hours on a Tuesday night once a week. That's what his current at-home living is. And if we're saying we can go right straight back to that and don't need additional care ordered, we're all grateful that he's doing that well, I guess. we didn't know that was the case.
I talked to him at length this morning. He was really itching to get out of here, and I said, let's just make sure our I's and T's are dotted and crossed, and we'll go from there.
Okay.
So it looks like the occupational therapist who kind of assessed the ability for patients to go home, groom themselves, feed themselves, take care of themselves, and irrespective of their physical needs, but that's physical therapist.
Yes.
And it looks like occupational therapy just said intermittent supervision was recommended, which basically just means if he was able to call somebody and someone come over and check on him, that sort of thing, that qualifies for home.
Yeah, I think I looked at that report.
Or anything like that.
Yeah, I looked at that report, the ADL report in the chart, and it said needs assistance like next to every single thing. And I went, 2 weeks ago he would have had that ADL and it wouldn't say needs assistance next to every single thing. So I guess on the family end, we're going to have to get him some assistance because he's going to be discharged. But your offer to check his blood once more before he leaves the building would be great. And then we will make, with that, with those results and your final sign off, we will make arrangements for family to come and get him. Yeah?
Okay.
We can do that as long as that blood work. Go ahead.
Yeah. Were you looking at the note from occupational therapy from this morning? Because everything on here that I'm seeing says independent.
I have a snip screen that my niece, his granddaughter had sent. And the snip screen right here. Okay, doesn't have a time stamp on it. It's the ADL screening, vision status, no impairment. And it goes further down. Grooming, needs assistance. Toileting, needs assistance. In and out of bed, needs assistance. Like it's the whole feeding yourself, medication administration, work, other activities, BMAT level 3, Morse falls assessment, history of falling 25, yes.
I think that's the PT. I think that's the PT note from a couple of days ago, because PT doesn't have their note in this morning yet, and occupational therapy put in their note at like 10:30 this morning, and it looks like everything was independent. Modified independent, had a bed elevated, independent with sit to stand, independent to stand to sit. Modified independent for functional mobility with use of a rolling walker, but they didn't recommend any rolling walker to go home with.
He has one if he needs it. Okay.
He has one.
So you're looking at something updated beyond what I saw. So I'm glad to hear that. Yeah. So if you want to do we would all appreciate that. At least one more blood run,
Sure.
just to make sure that something hasn't changed since 9 o'clock last night. And then we'll get our arrangements and we'll get busy on our end.
Yeah, I mean, like I said, if you need a day to plan, we could always do tomorrow if you wanted to do tomorrow, like a day of planning for today. But medically, he looks like he's doing well, and he was already asking this morning when he can get out of here. So,
yeah, it sounds like he's ready to go. We're just asking for that one last check, and that would help us be confident for him.
All right, sounds good.
All right, and
I'll
your
do that
name
right
is
now.
your name is Jake, and you're from
Jake.
trauma. Okay.
Yep.
Okay, thank you so much for your time and assistance with this, and I'll look for it. You're going to call back with that, or we'll just check the chart in a little while, or what should we do about the blood work to get to know?
Yeah, I can call back as long as nothing comes in throughout the day and whenever it comes back. So, yeah, I can call you with the results.
Okay, fantastic. Thanks, Jake. I appreciate it.
You're welcome. Yep.
Okay. All right, have a good day. Bye-bye.
All right. You too. Bye-bye.